All right. Welcome back, everybody. Welcome back. Again, it is day 2 of our Medical Aesthetics Bazaar. All week long, we have some amazing specials for you on our most popular aesthetics treatments. We also have all of our skincare on sale. And we also have some a few other treatments, so ophthalmic type treatments on sale. So IPL is one of those. Dr. Dang is going to touch on that. It's an amazing treatment for those suffering with dry eye, and LASIK, which we are going to have a session with Dr. Chang tomorrow, is also an amazing deal this week. So make sure you go to empireeyelaser.com/events to learn more about MAB. In the meantime, right now, I'm going to just let you know about what we're giving away. We are giving away a free dry eye relief kit at the end of this session with some amazing products in there that are going to help you find some relief from those red, itchy eyes if you suffer from dry eye. Also, if you have any questions for Dr. Dang, we will get to those towards the end of the session. So go ahead and leave those in the comments. If you want to be entered into the drawing, please also go ahead and leave that in the comments. And if you are not able to comment for some reason, you can also send us an email at info@empireeyelaser.com. If you are watching on Instagram, you have a little bit of a behind-the-scenes view today. We are going to kind of keep going through those slides for you, though. So stick around and learn a little something about dry eyes and IPL from Dr. Dang. So I'm going to go ahead and hand it over to Dr. Dang. Dr. Dang, welcome.
Hi, everybody. Welcome to this live session where we're going to be talking a little bit about some of the services that we offer here at Empire Eye and Laser Center. Like Alex was saying, my name is Dr. Vin Dang. I am the Dry Eye Clinic Director here at Empire Eye and Laser Center. And today what we're going to do is we're going to talk a little bit about, dry eyes. And, I'm sure, we, as you guys are aware, we live in this valley where a lot of these things cause some of these problems, right? So what are some of the most commonly associated symptoms with dry eyes? Like blurry vision. A lot of you will come and talk to me and say, hey, I feel like my prescription might have changed a little bit, and I feel like I'm not seeing quite as well. And what will happen is I'll check your vision, and then I'll notice that the prescription actually hasn't changed. And when I look at the surface of your eye, I actually see signs of dry eyes. The more common signs that you guys will complain about were usually about your eyes are being kind of irritated, that sandy, greedy sensation, or even that foreign body sensation. Like just earlier today, I had a patient tell me that he feels like his eyes are like sandpaper. Also, you'll feel like you have quite a bit of redness around your eyes, and that's usually caused from inflammation, whether it be due to allergies or due to the environment. Some of the other symptoms, including like light sensitivity, kind of feeling like, the when I shine the light in your eyes, you feel like you tell me like, oh, my eyes are just it's really bothering me. And then the last one that most people don't think about is also watery eyes. I know it sounds a little bit counterintuitive when I tell you that you have your watery eyes is caused by your dry eyes, but what happens is when your eyes are sort of out of balance, what happens is it's missing one component, and what it does is in order to make up for that other component, it overproduces tears. So what are some of the causes, right? So we know that obviously the environment is a big deal, right? So we live in Kern County, and we always kind of, I always jokingly say that you have this thing called the Bakersfield eye syndrome, where the air quality and then the amount of allergens of pollen is contributing to the irritation. We also know that certain prescription medications, whether it be things that you take for high blood pressure or even over-the-counter allergy medications, will tend to sort of dry up the eyes. We know that wearing contact lenses is another risk factor that's associated with dry eyes. Having some form of eye surgery as well, like LASIK eye surgery, will also contribute to dryness. In my female patients, cosmetic eye products, right? So the biggest trend nowadays is eyelash extensions, right? So those eyelash extensions will cause, if you're not going to a reputable place, or if you're not talking to your esthetician about the type of glue that they're using, that is a huge factor, right? one thing that you tend to not do as well when you have eyelash extension is not to clean your eyes as well. So when you don't clean your eyes as well, you develop this condition that's called blepharitis, which is inflammation or a mild infection of your eyelashes, which then contributes to the dryness in the surface of the eye. And during this COVID world, thankfully, we're moving out of the mask era, but the mask was also contributing to this, right? When you have a mask, you would have this thing that's called mask-associated dry eye. All day long, you would breathe, and that air would come into your eye, causing more dry eyes. And then, the last but not least is, unfortunately, as we get older, we know that everything gets drier. Your skin gets drier, your mouth gets drier, and your eyes are no different. So those are all of the things that are contributing risk factors that are associated with dry eyes. So when we're talking about, dry eyes and the tear film, the thing is that it's sort of made up of these sort of three different layers. We have the outermost layer, which is sort of the lipid layer, which is sort of like the oil layer that we talk about. And those come from the oil glands, which are the meibomian glands. And then underneath that, you have what we call is the aqueous layer, which is the tear layer. And then right beneath that, we also have sort of this mucin or mucus layer. So those are, you have to have a proportionate amount of all three of those in order to not suffer from dry eye disease. And if at any point you have sort of an imbalance in any of those three components, that's when you're going to suffer from dry eyes. So what we'd like to do today is kind of focus a little bit more on the oil glands, right? So what we talk about is that all along the eyelid margin, on the top and on the bottom, you have what we call our meibomian glands, right? So these are a type of like sebaceous gland, similar to the sebaceous gland that you have on your cheeks. And what happens is that when these oil glands, they get damaged, as you can see in the slide here, over time, you no longer have those nice skinny little white lines. As you go from left to right, you start noticing that the glands start to disappear and you start having more areas of darkness. And those areas of darkness means that the gland itself has been damaged and it's disappearing. When it disappears, the bad news is I can't bring something that's gone, right? So that's why it's very important to kind of catch these things early and treat it early. Some of the things that causes the damage to the oil glands are, the cosmetic products, the inflammation from allergies, ceiling fans, the environment, so all of these things. So what are some of the treatments that are available for dry eyes? Right, obviously, that you go over the counter, you get some eye drops, but the thing is that the eye drops at this point don't currently treat the oil glands at all, right? You have these Bruder Mask, which is part of this dry eye relief kit that we're raffling out today. What it does is it essentially applies heat to the eyelids, and when you're applying heat to the eyelids, you're hoping to keep the oil glands from being clogged, because one of the reasons why they get clogged is because they get cold, right? So it's kind of similar to, when you're cooking bacon. After you cook bacon and you let that oil sit there on the stove top for a little bit, what happens to that oil? Well, it turns into like bacon grease, right? And well, how do you turn bacon grease back into oil? Well, you have to heat it up, and that's what the Bruder Mask does. We have here at Empire this new treatment, and we've been doing it for several years now, and it's called IPL. And IPL stands for Intense Pulse Light. So this treatment was first developed by our dermatology colleagues, right? So they were using it for this skin condition that was called rosacea. Now, rosacea is a inflammatory skin condition that causes people to have sort of this red cheek appearance without having to use blush. And what that red cheek appearance is, it was mainly from the blood vessels that are surfacing onto the skin that's causing that redness appearance. So what our dermatology colleagues have found was that by using this laser or light therapy to target those red blood vessels, they were able to kind of shrink those blood vessels and make them go away. But what they also found was that the patient would come back and say, hey doc, I know you've been treating my cheeks for my rosacea, but over time, my eyes have started to feel better. So then that's when we started, from the eye care side, noticing that, if we are able to decrease inflammation indirectly by reducing the inflammation on the cheeks, we're also able to decrease inflammation on your eyes. And by doing that, we're able to help decrease the overall inflammation in the eyes, which then helps make your eye feel better. So this is what it looks like. When I'm doing the treatment, the treatment itself takes about maybe 10 minutes or so. It's real fast. It's very, very bright, so that's why I have to wear protective eye goggles. We have these special eye shields that we put into your eyes, so that way we're able to kind of treat. As you can tell here, the patient is protected, and then we treat the cheeks. And as we're treating the cheeks, we're decreasing the amount of inflammation on the cheeks. And now what happens is I move on to the eyelid part where the oil glands are, and I'm actually treating the eyelids themselves. So that's how you see here, I'm actually treating the eyelids themselves. Now after we're done with the treatment, I will go ahead and take you to the exam room where we'll go ahead and express those oil. And as you can tell here, this is kind of like that bacon grease that I was kind of telling you about, right? So we don't want that grease to be in the glands. We actually want oil to come out. So then after the laser treatment, as we do for these treatments, the consistency of the gland expression becomes from kind of a toothpaste-like consistency into an olive oil type. So this is kind of like some of the other condition that it's also able to see, right? So as you can see in the pictures, there's quite a bit of inflammation, right? So then this patient right here has a red irritated eyelid. On the top right here, you have a patient who's got a sty, right? So a sty is essentially just a pimple on the eyelid, right? So a pimple is an inflammatory condition, right? So you have these oil glands. When these oil glands gets infected or get clogged, and they keep producing oil, that's when you get a swelling, right? On the bottom right there, you got a picture of a gentleman that has a sty on the inside, right? When you pull on your lower eyelid and you look with your magnifying mirror, you see all the little imperfections, and those are the type of things that this particular IPL laser is also able to treat. It's also able to kind of talk about like some of the sun damages, right? So like what Alex was saying earlier, this IPL treatment also has quite a bit of aesthetic or cosmetic effects. It's able to, target the red blood vessels and decrease that. Some of the sunspots, like the freckles I have on my cheeks, some of the, darkening spots. So with this specific laser, we can also target those things. Okay. Now this is what I'm talking about. In the arrows here, you can see that this is the inflammation that we see on the eyelid margin when I'm looking with the magnifying lamp here. I'm able to see those tiny little blood vessels, and then surrounding those little blood vessels are actually the openings of the oil glands. So that's what we're trying to do. We're trying to reduce that inflammation, to make it so that the oil comes out is nice and clean and liquid. Okay. So this is a special pricing that we have this week, only this week. We typically charge $1,300 for 4 sessions. They're usually scheduled about every 2 weeks, but because of this pricing, we were doing it right now for $1,100. So be sure to give us a call or jump on our website to go ahead and get that pricing. All right. Do we have any questions, Alex?
All right. We do have a question. What is the treatment feel like, or is it painful, or kind of give us maybe the patient sensation of it? And along those lines, have you had it before?
Yes, absolutely. So one of the reasons why I'm so passionate about dry eyes is because I myself suffer from this condition. And that's why I don't want any of my other patients to have to suffer the way that I have. So I want to, provide you with the best care. I've had already about 15 sessions of IPL. My latest one was actually yesterday. I had Dr. Hydroeye, who's also in our practice, do my treatments. And that's why I'm able to sort of tell you the way it feels. So a lot of people are startled by the brightness, and that's one of the reasons why this particular treatment is called intense pulse light. The way it feels like, the best way I can describe it is it's kind of like a hot rubber band snap onto your face. So every time you do the treatment, it's like a little zap, 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 zap. I'm not sure if you saw in the video, you can see the patient was holding a fan on their face, because what happens is that over time, as we keep using the laser, it gets warmer. So then what we do is we have a fan that helps you cool down the face as we do the treatment. The discomfort is only during the treatment itself, and it's very tolerable. And then as soon as we're done with it, there's no lasting sort of like, side effects besides, you might have a little bit of a kind of tingling sensation, almost like you have a sunburn. And then the other precaution that we like to give our patient is sun exposure, right? So obviously we live in Kern County where it's sunny all year round. I mean, this week is still going to be in the upper 80s and sunny. So you have to make sure that you wear quite a bit of sun protection, right? So, at least SPF, 30, and make sure you reapply it, wear your hat, sunglasses to kind of minimize the overexposure to the sunlight from the laser as well.
Okay. And you mentioned a series of treatments. What do most patients do? How often do they get the treatment?
Yeah, so typically we start out with 4. Now every treatment that we do is customized based on your condition, right? So typically we like to start out with 4 every couple of weeks, like I mentioned. Now sometimes 4 may not be enough, and then you may have to do more than 4. But in a typical setting, it's 4. And after we do 4, then what I do is I tell the patient that we enter what we call as the maintenance phase. Now, it's just like anything else, right? It's nothing is a one-time deal, or nothing is a one-time cure. And unfortunately, there is no cure for dry eyes. It is a chronic condition that will continue to progress. So after we do your 4 treatments, on average, what I'll do is I'll have a patient come back, about 2 to 3 months after the treatments. So then I will reassess them, and then they will have a maintenance treatment, 1 treatment instead of 4 every 6 months to kind of maintain it, right? Just to kind of, because what will happen is you'll feel great for a while, and then over time your eyes will start feeling bad again because the inflammation will kind of come back. And that's unfortunately the thing about inflammation. It's just, you can control it with certain medication, certain procedure, but over time there's things that will cause it to come back. So.
Okay, wonderful. Thank you so much, Dr. Dang, for joining us today and talking about IPL and dry eye. I know it is big, and we are obviously very blessed to have you, our specialist here today, and also here in our office. So thanks again, Dr. Dang. Right now, I'm going to go ahead and pull up the winner wheel to see who wins. All right, there is our wheel. I'm going to go ahead. We're going to bring Instagram over here, the Instagram peeps, so they can see the wheel as well. And here we go. The wheel is spinning. And our winner of a dry eye relief kit is going to be Misty Karan. Congratulations, Misty. Congratulations. I'm not sure if you're on Instagram, not sure if you're on Facebook. Wherever you are, go ahead and shoot us an email, info@empireeyeandlaser.com, info@empireeyeandlaser.com, and we'll connect and get you your dry eye relief kit. Again, thanks so much, everyone, for tuning in. Tomorrow, we are going to have 3 more exciting sessions for you to tune in, and some more exciting prizes for you to check out. So make sure you go to empireeyeandlaser.com/events to learn everything there's to learn about our map that is going on right now. Also this afternoon on Instagram, go ahead and tune in for Chelsea doing a BBL photofacial. So this is actually the same machine, but this is going to be basically using it more for aesthetic purposes. So you can really kind of see how that machine works. And I think it's a great kind of connection here between that and what we just talked about. So again, thanks everyone for tuning in. Thanks everyone for watching, and we'll see you again tomorrow at 11:30. Bye.